Hello everyone! Today I will discuss about my article with title Gestational Diabetes Mellitus or GDM, the metabolic disorders during pregnancy. With me, Karuni Kartika Sari with the last student number 033. These are the topic discussions of our discussion today. And we start with the first one. Definitions of gestational diabetes mellitus. Diabetes mellitus is the most common complication during pregnancy, and this GDM defined as the broad spectrum metabolic disorder in the forms of glucose intolerance that cause hyperglycemia during pregnancy. The prevalence or incidence of GDM is quite high, which is 2 until 14% around the world, and will keep increasing because of elderly population, obesity, and sedentary lifestyle. These pictures show the spread of GDM around the world based on WHO. Pathophysiology of GDM starts with the increase of glucose need and insulin resistance during pregnancy. These conditions, if accompanied with pancreatic beta cells defect that cannot produce enough insulin, will result the imbalance between insulin resistance and insulin secretions. This imbalance we call as gestational diabetes mellitus. There are many risk factors of gestational diabetes mellitus, include mother age, mother obesity, mother family history of diabetes mellitus, and bad lifestyle of the mother. Screening and diagnosis is important and recommended pregnancy care at 24th until 28 weeks of pregnancy. The heart walker will measure the maternal blood glucose level and then determine the diagnosis by specific criteria using one-step strategy and two-step strategy. The GDM will affect the very serious complications. The complications for pregnancy include preeclampsia, polyhydramnion, imminent premature labor, hypertensive disorder, urinary tract infections, and abortions. The complications during labor or childbirth include cesarean sections, shoulder dystocia, prolonged labor, and maternal morbidity. The complications for maternal after childbirth include obesity, cardiovascular disease, and type 2 of diabetes mellitus. And the last is complication for neonates or baby include hyperinsulinemia, hypokalemia, hyperbilirubin, hypoglycemia, macrosomnia, and obesity in children. The proper management is needed to handle the GDM. The first is management during prenatal or during pregnancy include glycemic control diet, physical activity, and pharmacologic therapy include insulin and metformin. And then the management for labor condition or childbirth, the cesarean section method will be recommended. The third is management for postpartum or after childbirth include the routine glucose test and lifestyle modifications. The conditions of GDM can be prevented by lifestyle interventions. There are 3 steps. The first is dietary interventions with low glucose and weight loss before pregnancy. The second is physical activity interventions with intense and regular exercise. The third is nutritional interventions with consumption of bioactive agents such as myo-inositol and probiotics. Also, consumptions of micronutrients such as vitamin D, iron, and selenium. Okay, that's all my explanations about the gestational diabetes mellitus. I hope this video will be useful. Thank you for your attention and have a good day, everyone.